So welcome to this 8th module of this addiction recovery course. And here we will be discussing the psychological pillars. What are the things you can do to heal your mind, to regulate your emotions, to heal the trauma, to make sense of the trauma, and then come to that place where you're able to rewrite your story. We've been saying it repeatedly that addiction is at the brain level, at the neuronal level, at the psychological level. So your recovery begins when your mind begins to heal. So that's an important fact you want to keep in mind. Why is your psyche important on this healing journey? We've said repeatedly that addiction is an attempt to manage or soothe psychological or emotional pain. So recovery will then mean that you're taking care of unresolved trauma, however long ago you occurred. Would also mean that you're managing healing anxiety and depression. Will mean that low self-esteem is completely resolved. You're someone of a normal, healthy self-esteem. It would also mean that emotional wounds are taken care of. Unhealthy thinking patterns are changed. Negative belief systems are deconstructed, and positive pro-destiny belief systems are implanted. It will mean that shame and fear are no longer there. We've said again and again that addiction is like a tip of the iceberg. What is beneath the iceberg are these things or these psychological struggles listed here. So again, stopping addiction does not mean that you have recovered or that you have healed. That would be that someone had an accident. You take them off the accident scene. Does not mean that they have healed. They have to go get a doctor, take care of the wound by virtue of exploration, suturing. If there's a fracture, you put a splint there, and then you say the person is on the trajectory of healing. So healing will happen when you address what made the addiction necessary psychologically. Now, CBT is a profound approach that everyone who is trying to recover from addiction must have a sound understanding of and then be able to apply it on themselves. You should be able to sit and do CBT on you. CBT just means cognitive behavioral techniques. It's an interplay of your thoughts, your emotion, and your behavior. Every thought you would have is influenced by a set of core beliefs. Core beliefs are usually seeded oftentimes in childhood by the kind of upbringing you had, by the kind of adverse or positive experiences you had, by the kind of cultural construct in which you grew up, what was modeled to you, what was repeated to you again and again. So every thought we will then have in relation to any occurrence is hinged on the core beliefs that we have imbibed at the subconscious level. Subconscious, you're not conscious of it. If you are aware that this is the core belief I have, you'll be able to pluck it out. But see it as something that is deeply rooted in your soul. Which is why the Bible says that let this mind be in you, which was also in Christ Jesus. So there's a mindset, there's a belief system you must have that would perpetuate recovery. When it says that you cast down every thought and every imagination that exalts itself against the knowledge of God. So there are some thought patterns. There are some imaginations that exalt itself against what God has called you to be and who you really are. If he says that you do not be conformed to the patterns of this world, again, he's saying that there's a pattern, there's a mindset, but not to go so spiritual on you. I'll give you an example. You have two 25-year-old young man. One grew up in an atmosphere where parents were always at loggerheads. For the slightest offense, they were beaten with barbed wires. And there was another one that grew up in an atmosphere where parents were loving. And for any offense, they were called, corrected, taught how they should act better. And if a punishment was supposed to be administered, it was administered with understanding. So the first one came out of a childhood and felt, I'm not good enough and I am not loved. And another one came out of their childhood with the mindset of, I am someone of worth, I'm someone valuable, I'm someone loved. If these people experience a negative situation later in life, you can be sure that they would have two different thought patterns because their core beliefs are different. Two different thought patterns will create two different emotions. Your emotions will influence your behavior. How you act over time becomes who you are. And in the context of addiction, sometimes your behavior may just be that you're getting looped in the addiction cycle again. So the thought, emotion, behavior cycle then means that when someone happens, something. So let's give an example. Maybe you texted or you messaged your friends and they don't reply quickly. And someone who has a core belief of they are not valued or they are not loved or people would always hurt them, what might their thoughts be? They may start thinking they're ignoring me because I'm not important. I'm not important is a core belief. Because the question we then ask is, what kind of person is not important? Someone who is not good enough, someone who is not wanted, someone who is not loved, someone who is not valuable. Does any of this ring a bell? Okay, and these are things you have to really intentionally see through it for every situation, every occurrence. Now, if this individual believes that they're ignoring him or her, what is the emotion? Could be rejection, the feeling of being rejected. If you feel you're being rejected, you're sad. And then if you have not grown the coping mechanisms to be able to deal with negative emotions, what do? You probably say, okay, let me drink so I can just forget it. Forget about them, forget about the feeling. And what happens? Of course, there's temporary relief because you've escaped that discomforting emotion. But when the temporary relief wins off, what does the person feel? There's shame, there's loneliness, and then the addiction cycle or a relapse may begin. So in recovery, you want to begin to change your thoughts before your behavior will change. And changing your thought, affirmation is one of such. Journaling so you can track your thoughts and be able to do a thought challenge is another thing. A therapist who is skilled in CBT or inner child healing or compassionate inquiry should be able to help you with this. So it wouldn't mean that if you're even seeking a therapist, you ask, what approaches would you use to help me manage this addiction, manage my trauma, and be able to steward my recovery on a permanent term, on a lasting term. So now your emotions are not your enemies. They are just messengers. You know, the same way you have hunger pangs. If you have hunger pangs, what does that tell you? It says you're hungry. You're supposed to pay attention to it, and from there ask yourself, what do I then do? So emotions will tell you something needs attention. So the goal is not that we avoid emotions, we say we don't feel it, it's that we explore them. We explore and respond to them wisely. And exploring begins with even identifying, recognizing that there's an emotion. So you feel off or there's a craving. Pause, take a couple of breaths and ask yourself, what am I feeling? And then name it. Okay, I feel angry. I feel scared. If you have been schooled in body work, I may then ask you, where in your body do you feel this fear? Many times we feel fear in our heart, in our chest. Or if you're angry, I may ask you, where do you feel the anger? Many times we feel anger in our head. Or if you are tired, exhausted, if I ask you, where do you feel it? Some people feel it on their shoulders. Okay. Now these are not new age. These are proven scientific body therapy research and work that is just what it is. If I sit with you and I ask you to do a self-exploration, you'll be able to pick out bodily sensations. So, but being able to name them is the first thing, and then accepting, okay, so this thing that happened made me feel angry. And then I may ask myself the next question, why does it make me feel angry? What are my thoughts about that? Okay, maybe my thought is, how dare he talk to me like that? Or how dare he react like that? And then I ask another question, what do I make him mean about myself? What kind of person gets spoken to like that? And then maybe a belief comes up, someone that is not good enough. And then I ask myself, do I believe I'm not good enough? That's self-exploration. And then maybe it comes back to me, yes, okay, I ask myself, is that the absolute truth? Or is it a lie I have imbibed over the age because of what happened? If you're sitting with me in therapy, I'll probably ask you, how far back does that go? What is the earliest memory of this feeling of not being good enough? And many times in deep work, someone may be able to pull up a 5-year-old, a 7-year-old, a 10-year-old memory when this belief was seeded. Again, it begins as an experience, but you know, as you have more and more experiences in childhood, it keeps piling up till it becomes deeply embedded in your subconscious. A 5-year-old is not really conscious. Most of us don't even have a detail of our 5-year-old memory as such. So it's seated at the subconscious level then. So you then understand this emotion and then be able to ask yourself, okay, so if it's not true, what is true? What is true is that I'm valuable, I'm good enough, I'm worthy, okay? And then if I believe this truth that I'm good enough and I'm worthy, how would I act? What would I do? How would I do differently? Would I reach for a bottle of alcohol? Would I reach for the weed to wrap it up if I believe I'm someone who is good enough, who is valuable? No. What would I do? I'll probably call the person and say, you don't talk to me like that. Or I'll say, okay, let me journal it out and really be able to understand myself. So I've changed my core beliefs. I've changed my thought patterns. And I'm now beginning to change the trajectory of my life, one experience, one situation at a time. You really take it one day at a time. In fact, one moment at a time. So instead of asking, how do you stop feeling sad? How do you stop feeling hungry? It should be that. What's this feeling trying to tell me? And you do a deep self-exploration. If you are in the life cohort, these are also things that we will sit and deal with and teach you how to self-explore your emotions and what you feel after any experience and what you have come to believe over the age, over the time. So now there are some common cognitive distortions that perpetuate addiction and make recovery very difficult. They are like thinking traps that would increase emotional distress and just fuel addiction. Our mind will always tell us stories. but your thoughts are not always facts. In fact, your feelings are not always facts. Even the Bible says that we see in parts. So your thought is in parts. Your feelings are in parts. They are not facts. They are not 100%. Regardless of how much or how strong, how tightly you feel them. The only person who has a panoramic view of everything on earth is God, not you, no one else. So even the best of us, our feelings are not 100%. So they're not facts, even science, not all the time. All right, so a very common distortion is all or nothing thinking. They're seeing things in the extreme. So you made a promise and then you were not able to hold on to it. And you feel, if I made this one mistake, then it means I have completely failed. That's all or nothing. It was just one mistake. It was just one failed promise. It's not the end of the world. An healthy alternative will be that you made one mistake. You can learn and you can continue. Then catastrophizing is expecting the worst possible outcome. Okay, you made a promise and then you failed to live up to the promise. Or you made a mistake and you assume that, my life is ruined forever. From one mistake, that's catastrophizing. You're making a mountain out of a molehill. An healthy alternative will be that this is painful, but I can recover and move forward. Mind reading, when you assume that you can read other people's minds and you assume that they're thinking about you negatively. Nobody can read another person's mind. So the so-called mind readers, no. They're just people who can play with your psyche. And then you may have a distorted thought that they must hate me. Must hate me, that's an assumption. Because you think you can read their mind. An healthy alternative will be that I don't know what they are thinking. Then emotional reasoning is when you place feelings above facts, or you believe that your feelings are fact. If I feel like this, then it must be the reality of your life. So if you feel worthless, it must be that you're worthless. If you feel sad, it must be that you'll forever be sad. Your feelings are real, but they are not always facts. Especially when you're coming from the construct of trauma. Children, before they learn to really understand their hunger pangs, every time you ask them, do you want to eat? They say yes, they say yes, they say yes. Whatever they are feeling then feels like hunger, but you fed this child 2 hours ago. Is that really hunger? Like I told you, the sadness, the joy, the fear, interpret it as biological signals, the same way your hunger pang is. But after a while of growth and managing your appetite, you should be able to answer at certain hours of the day that you are not hungry and no, you don't want to eat. If you cannot answer that no, I'm not hungry at this time, then it means you have also lost ability to discern your hunger pangs. That's a distortion on its own. Many people are on that spectrum. But it should be that by virtue of growth too, you should be able to understand this is just a feeling. It is not who I am. Then overgeneralization is seeing a pattern based on an event. So one event happens and you assume that it is always going to be like this. It happened once. It does not mean it will always happen. You had a slip up. You had a relapse. You smoked when you thought you were not going to. It happened once. It doesn't mean that you will never be able to quit. It doesn't mean that your recovery journey is sabotaged. Then labeling is when you attach a negative label to yourself. I'm an addict. How does that help you? In fact, there was a research where, was it research or a life experience where, it was a research, a group of people who were trying to quit from nicotine were told, the first staff were told to say, I'm trying to quit from smoking cigarettes when they are offered a cigarette. The other group were told to say, I don't smoke. I don't smoke at all. It's not like I'm trying to quit. It is that I don't smoke. And they found that over a couple of months, those who reported that they don't smoke, it means they, by virtue of repetition, subconsciously have it seeded in their mind that they don't smoke. So it was easier for them to decline every time. And people even stopped offering them once they hear, I don't smoke. But the ones who said, I am trying to quit, many of them did not last. Because by the time you say you're trying to quit, it means you have not quit completely. You are still on the journey. On the journey, it leaves you with so many uncertainty. I don't smoke means you have left that bus long ago. So you are a person who is not an addict. Then personalization is blaming yourself unnecessarily. So when people say it's my fault, everything went wrong. I can rather it should be that I can take responsibility for my part, but not everything. So you want to remember that you are not your thoughts, and you can challenge negative thoughts and change your life. So awareness is the first step. Find those distortions and challenge them, and choose the healthier thought patterns every time. We also discussed shame versus guilt in the earlier module. And shame is one of the greatest psychological barriers to recovery from, you name it, trauma, you name it, addiction, you name it, what. Now, guilt would say that maybe guilt may be better than shame, but there could also be pathologic guilt. But if the guilt leads you on the trajectory of maintaining your sobriety, if it arouses in you questions like, how do I do better? And arouses in you convictions like, I can do better, I am better than this, then it's positive. So guilt would tell you something like, I did something wrong. So it focuses on your behavior, not on your identity, and leads to a sense of responsibility, because then it will encourage you to change. But you see, shame, it tells you you are the something that is wrong. So it focuses on you, focuses on your identity. If I believe that I am the wrong person, or I am the something that is wrong, excuse my grammar, what do? I'll likely go into hiding. And then from there, what does it do? Create a sense of hopelessness. Hopelessness, by the time you get into hiding and you get into a sense of hopelessness, you know that's survival. That's not safety. In survival, what do? We're looking for a means of escape. The means of escape is oftentimes a relapse, because it tells the individual you're not good enough, you're not worthy, you're not wanted, you're not loved. That's shame speaking. Shame will tell you you've already failed. Why bother trying? Recovery will tell you one mistake does not erase your progress. So your identity is solid. It doesn't change. The way you steward the identity maybe what needs to be improved. So if there's anything I want to remind you again and again, self-compassion. Your identity has been set from time immemorial, created in the image and in the likeness of God. There's nothing you do or you don't do that will change the identity. Like I told you, a bottle of Coca-Cola, a glass of Coca-Cola, whether you put kerosene inside, if you're in Nigeria, you know what kerosene is, or you put palm oil inside, or you put jig inside, or you put water inside, it is still a bottle of a glass of Coca-Cola. If you wash that glass and return it back to Coca-Cola company, they will still bottle that glass with Coca-Cola products. So what happened? The identity of that glass is intact, but you were using it for the wrong thing. Your own identity too is intact, unchangeable, but you are stewarding yourself wrong. That is what we need to address. But you must now come to that place of embracing a positive, holistic identity and tell you, no, I'm better than I'm better than storing palm oil. I am meant for storing Coca-Cola products. So I wash myself up and present myself to the manufacturer. You know who your manufacturer is, and say, bottle me up. Make me better than before. So healing trauma and building resilience. We said again, trauma is not just what happened. It is what happened in you and how it changed your mind, your body, your psyche, and trapped you into a survival mode. So when you say you heal, it's not that you have forgotten about it. The blueprints of the trauma is still wired in your neurobiology. Your recovery would mean that you are coming to that place of safety within your soul. Yeah, safety within your soul is found in God, found in therapy, found in intentionality. All of it combined together. Biopsychosocial spiritual approach. And that will include that you building safety. You want to curate environment and relationships where you feel safe and secure. That will mean that if you're going to imbibe the psychological pillar, some hangouts cannot happen again. Some visits cannot happen again. Some calls cannot happen again. You know what I'm talking about. Fellow users, sex consults, just the people that help you perpetuate the addiction. Then, by virtue of therapy, by virtue of all that you're learning here, reading, and every other positive thing, you're learning to understand, to manage and express emotions in healthier ways. Then you're also learning to process painful memories because you by therapy, hopefully, therapy. Because if you've had a traumatic childhood, which undoubtedly you do, if we are talking about addiction recovery, you want to walk through the past experience. Then, of course, you also stewarding healthy relationships, building connections on trust, respect, and mutual support, and then self-compassion. You want to extend the same grace that you would give to others, to yourself. So now, on this psychological pillar, it's also good to understand what are healthy relationships, what are unhealthy relationships. Because what I find is, for those who are trapped in survival mechanisms, especially if you're trapped in phone and freeze response, you may need to go back and watch module. I think that's module 6, or you may need to go back and watch that. You may be in an unhealthy relationship, or because you are a people pleaser, you don't like to offend people, you would overextend yourself and continue in a negative relationship, or because you're frozen, you are numb, you are emotionally apathetic, you don't know how to even process things, you may find that you continue to stay in unhealthy relationships. Unhealthy relationships will not sustain your recovery. So why we would not want you to heal in isolation, we want you to surround yourself with right people and then be able to let go of people who keep you down. But you must be able to identify them for you to know these are one of such relationships. For the unhealthy relationships, you are looking for one or two, target two. Because by the time I explain, you find that some of the things that are being done may be that they are trying to steward you towards health, towards recovery. I'll tell you what I mean. Maybe you have a parent who is always telling you, baby, you can change, you can improve, you can stop this, or tells you, this is your friend, I don't like the friend. They're not criticizing you, they're just trying to steward your recovery. But if the same person who says this also disrespect boundaries, is communicating harmfully, you notice a number of factors that are showing up in this relationship, even if it's a parent-child relationship. Because the truth is there are some parents who are toxic. But again, that's a talk for another day. So unhealthy relationships will have a number of these things I will discuss. They bring you down. It's the same person who criticizes, who belittles you, make you feel less than, who would also push and manipulate you to get their way. So they are disrespecting boundary. It's also them that will lie, blame, and use your past against you. So it's not just one, it's a number of things combined together. And many times they are inconsistent. They would only be there when they need something. So they are trying to change you is hinged on all of these other things. Not that they are trying to change you because they believe there's a better life. You're wise. I know you should be able to discern when someone is trying to change you. This course, this if I can call it that, that you're watching is changing something in your mind, but it's changing you for the positive. But I'm not here criticizing and belittling you. I'm not disrespecting your boundaries. But I'm trying to change you or trying to encourage you, motivate you towards change. So identify unhealthy relationship will not mean that I say, okay, my parents are always saying I should stop. That means that's an unhealthy relationship. No, that's not what I'm talking about. It is that this relationship harbors a number of this dysfunctionality. Once you see it, check out. It's not safe for your recovery. Now, healthy relationships should build you up. They should encourage your growth. They should celebrate your progress. They should respect your boundaries, honor your limits and personal space. If you say, please give me a few minutes, I need to clear my head, that should not be a problem with anybody. If you say, please, I can't respond now, could you give me a couple of minutes or some days to get back to you, that should not hurt anybody. Then healthy relationship will communicate honestly. They will speak truth with kindness and listen with care. They will offer consistent support. They show up for you, not just when it's convenient for them. And they accept you fully on your recovery journey. I don't mean they accept your dysfunctionality. If they accept it, it's because they know you're on the recovery journey. Because codependent relationship may accept you fully with all the flaws and dysfunctionality, and they're just perpetuating it. Again, this kind of relationship would, before you say it's healthy, would have more than one of these factors, would have all of these factors before you now say they accept you fully. So healthy coping mechanisms, coping skills that you want to keep in mind, journaling. You have said it earlier. By now, I hope you've got a journal. I hope you've begun pouring out your thoughts on paper as frequently as possible. I usually would say on a daily basis. You know why? If you saw me in the clinic as a doctor, not as a therapist, if I place you on drugs and I say it's daily, that drug, if it's going to work, has to be daily. Now, if you need to journal because life has happened, I tell you, you have a lot of psychological baggage. And the earlier you start dropping them down, the earlier you start unraveling, the more the mileage you'll be able to cover. So consistency over intensity. If you do 5 minutes every day for 30 days, you would unravel more than someone who does 2 hours once a week. So it's consistency over intensity. So write down your thoughts and emotions. Ask yourself questions. Why do I feel like this? Why do I think like this? What is true? What is the absolute truth? Okay. Then deep breathing will help to calm down your mind and reduce stress. It activates your parasympathetic nervous system too. Prayer and scripture meditation will connect you with God and find peace in His truth. Would also deconstruct negative mental beliefs and implant positive pro-destiny belief systems. Then exercise and walking will improve your mood, and the fact that you're moving your body too also improves your immune system, keeps you more agile, keeps you more active, takes the thoughts away from that which is dragging you down. Music will soothe your soul and shift your emotions. Art and creativity, coloring, painting, crocheting, just art, any way you can express yourself in ways that words cannot describe. Then talking to a trusted person when you share your feeling and someone is able to listen, again, you are onboarding. Then therapy will help you to gain insights and tools. Mindfulness will allow you to stay in the present because trauma would leave you straddling the past and the future and takes you out of the present completely. And it's that survival mode that keeps many people trapped in addiction because they just cannot deal. They're thinking of the worst case scenario and sometimes about the crappy things that's happened in the past. And they forget to be here and just breathe and be thankful for this moment. Then you want to also practice gratitude. You focus on the good and build up each day. So now keep in mind, recovery is not that you're not having difficulties. It's that you are developing better psychological and spiritual and biological and social tools to be able to handle the many curveballs that life will throw each and every one of us. So now let's reflect on a number of things. And I'm hoping that you get a piece of paper if you have to pause this or slow it down or pause every question and make a bit of writing. It's well worth it. What is one thought pattern that shows up for you most often? We call them automatic thoughts. Many times they're negative automatic thoughts if we are talking about addiction recovery. And how has these thoughts impacted your emotions and your behaviors? What earlier thoughts can you challenge this distortion with? So what coping skill or alternative will you practice this week? And who is your support on this recovery journey? I want to hope you already got one, at least one. Could be daddy, could be mommy, could be sister, could be brother, could be spouse, could be friend, could be your clergyman, could be your therapist, could be a cousin, could be an uncle, could be an aunt. And no matter how small, what is one thing you're thankful for? What is one win that you're proud of that you say, yes, I did this in the past 8 models, I've done this and I'm proud of it. So remember, it is small, consistent effort, consistency over intensity. So as always, thank you for always being with me. I hope this has been beneficial, helpful, and I wish you healing, hope, and a lasting recovery. Until next time, God bless you.